And welcome back. Dr. George Salib is here today, Orange County Eye Institute. Nice to see you.
Nice seeing you too, thank you.
Subject we're going to talk about today is LASIK, which many of us have heard. It's been around for quite a while, but there's been a lot of advances with that. And first of all, when I'm looking down here at the notes you sent, one of the things I notice is that the word LASIK is all in caps, which usually means it stands for something, right? So in a nutshell, what is LASIK? How does it differ from, I guess people would call it laser eye surgery of 10 years ago or 15 years ago?
Well, LASIK actually stands for laser-assisted in situ keratomyolysis. It's just it's a mouthful basically. Yeah. So we usually like to use just LASIK. And LASIK is basically laser vision correction. So if you wear glasses or contact lenses and you wanted to be able to see without them, then you would have this LASIK procedure. And it's really come a long way as we were talking about. From the 1990s when it first started out, millions of procedures have been done since then. And what we normally do is we'll just numb up your eyes with some eye drops, have you laid down. We'll use a laser to create a flap of tissue in your cornea, which is the front part of your eye, the part that you would put a contact lens or the very front part of your eye, and then we lift that flap, and with another laser, a cool pulsing laser, we actually shape the front of your eye so that it matches the prescription of your glasses or contact lenses. Okay. And we replace the flap, have you go home, take a nap, and when you wake up, it's a whole new world. You can see things clearly without your glasses or contact lenses. It's almost a giddy feeling. I've had LASIK myself, so I know the feeling. And every day when I wake up, I don't have to reach for my glasses or contact lenses. I don't have to worry about cleaning them or buying them, and it's a wonderful feeling.
And can anyone get LASIK? How do you know if you're a good candidate or not? For instance, somebody like myself, I always heard there's no point in it, or for me, basically I need reading glasses, that's it. Now, of course, I'll be the first one to say that I have noticed over the past 5 years that my distance vision has always been very, very good, and it's not quite as what it was a few years ago. So who are the candidates? What type of eyesight? Nearsighted, farsighted, astigmatism, that sort of thing.
Well, LASIK actually can correct both farsightedness, nearsightedness, and astigmatism up to certain numbers. We look at the numbers of your eyes. So most people are actually good candidates for LASIK, but the only way to really find out is to come in for an eye exam. And we offer free LASIK evaluations for people interested in LASIK. And we have to do basically a battery of tests to evaluate your eyes to see if you're a good candidate. We first find out your past medical history to see if you have any contraindications, any things that would prevent you from having LASIK. We look at your medications as well to see if there's anything. So, for instance, some medications like Accutane can cause some drying of the eyes. So if you're on that, we suggest you stop that before going and having LASIK. We do a corneal topography, which is a surface map of the front of your eye to see if you have conditions such as keratoconus, which is a fancy name for abnormal thinning and curvature of your eye that would prevent us from doing LASIK. And then we look at your eyes to see if you have cataracts, any retinal problems, any optic nerve problems. And then when we finally come up with a whole evaluation, then we talk about it and see if that's something you want to do. If you're happy with contact lenses, if you like putting contact lenses in your eyes and cleaning them, if you like wearing glasses and buying them, and you're having no problem, then you don't need LASIK. But if you want to try and do without them and have the freedom of being without glasses or contact lenses, then it's a wonderful procedure to have. And for some people, it's not the right procedure. Like if, for instance, you really want to be able to read without glasses, past the age of 42 to 45, you will need glasses to read, whether you had LASIK or not. So, and that changes as you go between 40 and 65 years of age. Some people actually have one eye set for distance and one eye set for near. About 60 to 70% of people like that, and that's called monovision. So for the vast majority of people, it's a great procedure, but we do some tests to find out if that works for you.
So somebody like me who uses glasses to read, computer, nowadays even when I'm chopping up an onion when I'm cooking, I find I need it more and more. For somebody like me, it probably wouldn't. I'd still need my glasses. Is that
Well,
what you're
you would
saying?
need your glasses for reading or for doing those close-up things, unless you got monovision,
Okay.
which is where you had one eye for close and one eye for
Okay.
far. But most people would rather have just great distance vision. At least you don't need the glasses for distance, and then you just put them on for reading.
Okay.
So both options are really good. The monovision, most people like that, but if you wanted to do that, we would first test you out in the office by just putting a contact lens in each eye just to simulate what that would look like. And then if you like it, then we go ahead and can do the monovision.
Okay, very good. So, all laser LASIK, I thought it was always all laser, apparently not. How does that differ from conventional LASIK, and are both procedures done for certain situations?
Well, all laser LASIK
got
is
it.
basically, yes, is the more modern way of doing it.
Okay.
So there's two parts to LASIK. First, we have to create a flap on the cornea, which is the very front of the eye. And nowadays we use a laser. And the laser can create a flap with very precise measurements, very precise specifications, and within perhaps 11 seconds or so, we then we lift up the flap as seen in this picture, and then we use a different laser right side by side. It's a cool pulsing laser to actually shape the cornea. So in this case, both parts of the procedure, the flap and the shaping of the cornea, were done with the laser. In the past, and in some offices, they still use a conventional LASIK where they have, it looks like a razor blade that moves back and forth very quickly in a machine that you put on the eye to create the flap. So, there are certain complications that can happen with conventional LASIK. Just, for instance, if you have a little nick in the blade or some little shavings from the blade itself can get into the flap that you wouldn't get with a laser. Of course, there are some complications with laser that you wouldn't get with the conventional, but overall, I like the precision and the accuracy of the all laser LASIK, and that's the one method I prefer to use.
Okay. What is the success rate of LASIK? How long does it last? I know in the past there were sometimes complications. You hear people saying, I get like a star pattern or something like that. I don't know if that was true back then or true now, but are there some complications that can arise?
Well, as with any surgery, there are some complications that can arise. However, in about 98% of cases, LASIK is an extremely successful procedure. So 98% of the time, you have great results. And the vast majority of patients who undergo this procedure can see 20/20 or better. In fact, a lot of my patients are so giddy, they're telling me that their vision is actually better with LASIK than when they had to wear glasses or contact lenses, because you have some distortion from glasses whenever you're wearing them.
Sure.
And you have a rim around your eyes. So when you finally are not able to, you don't have to wear the glasses, you see overall better. You can see better peripheral vision. At least a lot of people report that. But yes, in about 1% to 2% of cases, you might have some complications. You might have to redo the surgery if your eye doesn't heal according to specifications. But again, most people, I would say about 98% of people, have a very good result.
And how long does it last, and does that depend on age? We all know our eyes change. So if somebody has LASIK at age, I think my sister first had it, she was probably in her mid-30s. I remember it was quite a while ago. She's 47 or something like that now. Does that mean she'll have to have a redo later on?
No. In fact, if you need a redo, most people will know they need a redo within 6 months or so.
Okay.
So the actual measurements stay fairly stable in most cases all of your life. The only difference is if, let's say, you have it below the age of 40, so when you're above the age of 40, that's when you might need reading glasses. So a lot of people say, oh, it doesn't last past 40.
Oh, I see, okay.
But you do see past 40. I'm past 40, and I can see very well at a distance. And now I could still see up close, but I'm starting to feel a need for reading glasses. So definitely, it actually lasts all your life. I suggest people wait till they're at least 18 to 21 years of age before you have LASIK. And then it usually lasts, as I said, all of your life.
Okay. What are are the payment plans? Are there, first of all, is this generally covered by insurance? Does insurance turn around and go, just get glasses?
Most insurance plans do not cover it. There are
Okay.
certain insurance plans that do cover it, but those are few and far between.
Okay.
In most cases, this is an elective procedure, and you can pay either cash, credit, check. And if you wanted to pay with a payment plan, if you didn't want to pay it all at once, there are certain payment plans such as Care Credit that allow you to pay over a whole year without interest. So that's very convenient.
Okay.
There are also people who choose to use their health savings accounts where you can actually have pre-tax money placed into an account for health benefits, and you can actually use those
Okay.
for LASIK as well. So many options to be able to do this procedure.
All right, and of course, the first step is to go see Dr. Salib, and if you're interested in this, to see if you are a good candidate for it. And interesting information that you gave here, because I think, every month you come on and we talk about different things, but I think it's been quite a while since you've spoken about LASIK, and it's still a great procedure, and it's nice to see the advances of that.
Yes, thanks. And it can also be used for some cataract surgery, which I perform as well.
Okay.
You can actually use some of the laser technology from LASIK for cataract surgery. So lasers are always advancing, and I'm happy to be able to do that.
All right, great to see you, and thanks for the information. There's the doctor's phone number there, 380-EYES, 387-3937, Orange County Eye Institute, or OCEyeinstitute.com. Nice to see you again.
Nice
Take
to
care.
meet you. Thank you.
We'll be back in just a moment.